We all want chocolate to be a health food, but the reality is that most of the commercial chocolate we consume is sugary candy that actively worsens our cardiometabolic health. At the same time, essential hypertension and high LDL cholesterol remain massive global health crises. We are in desperate need of natural dietary interventions that actually work. Recent large-scale meta-analyses and Mendelian randomization studies have successfully separated the candy from the medicine. This dataset maps out those risk reduction metrics, isolating a specific statistical benefit, a 27% drop in the risk of essential hypertension. These findings establish a specific protocol, using dark chocolate with a high cocoa percentage as a clinical tool for cardiovascular defense. To understand how this works, we have to look past the food itself and focus on the active compounds inside, polyphenols, specifically a class of flavonoids called epicatechin. This visualization shows epicatechin compounds interacting with the endothelial cell wall. This interaction signals a rapid increase in the body's nitric oxide-rich pools. That nitric oxide leads directly to vasodilation. It physically relaxes your blood vessels, driving down both your systolic and diastolic blood pressure. Epicatechin also provides a secondary cardiovascular benefit by inhibiting platelet adhesion and aggregation. This prevents blood cells from clumping together, functioning similarly to low-dose aspirin. The value of dark chocolate lies in its ability to mechanically remodel and relax the environment inside our veins. When patients consume cocoa consistently over a period of 4 weeks or longer, these microscopic biological mechanisms translate into clear clinical outcomes. Compared to baseline, cardiometabolic risks drop. Total cholesterol falls 8.35, LDL 9.47, and fasting glucose 4.91. This scatter plot shows significant reductions require a dose-response threshold, clustering heavily above 400 milligrams of daily polyphenols. It is also vital to establish what cocoa fails to do. Across these clinical trials, there were no statistically significant improvements to body weight, body mass index, or waist circumference. The clinical evidence defines dark chocolate as a specific intervention for vascular health and glucose metabolism, with no measurable impact on weight loss. Applying this clinical data means navigating the supermarket aisle using a strict set of parameters. The non-negotiable baseline rule of this protocol is concentration. The product must be either pure cocoa extract or chocolate with a minimum of 70. For optimal dosage, treat a single square like a daily dietary supplement. Combining it with nutrient-dense foods like berries provides the dietary synergy needed to avoid the excess sugar and saturated fat that comes with eating larger quantities. There is one necessary medical caveat. Pregnant populations need to be careful. High polyphenol intake during the 3rd trimester can cause fetal complications, so daily intake should be limited to 125 milligrams. By adhering to these concentration and processing standards, you can integrate high-quality cocoa as a consistent tool for long-term heart health.